So which of the following is the most likely cause? Now, this patient was having massive hematemesis, so he was given blood transfusion and then he developed a blood transfusion reaction. What were the features of this reaction? It's that it was very acute. It was within 5 to 10 minutes. Okay. Next, you have to see what were the features. So there was chills, there was pain in the lumbar region, and there was oliguria. His vital signs changed to pulse of, okay, there was tachycardia, the respiratory rate increased, his temperature increased, blood pressure went down. Okay, now what is the most likely condition? Okay, now I'll give you a key tip. If the patient is having respiratory distress, urticaria, hives, severe SpO2 if his SpO2 is falling, if he's having such low hypotension, you think of anaphylaxis. Okay, so there is disturbed vital signs, there is fall in SpO2, there is breathing difficulty. Down, that is your anaphylactic reaction. But if you have chills, these are buzzwords, okay? These are buzzwords. If you see this, this is the answer. If there is chills, if there are renal damage signs, right, like the pain in lumbar region and oliguria, if there is acute renal damage, it is your acute hemolytic transfusion. Whenever you see your kidney is involved in any BTR, it is your hemolytic transfusion reaction. If there is anything to do with allergy, breathing difficulties, or anything, it is your anaphylactic. If it is just fever and the vitals are stable, the BP is stable, the temperature is increased because it is febrile, but rest of vitals are not that affected, then it is a febrile non-hemolytic transfusion reaction. Transfusion-associated sepsis will again present with high fevers and all, but it will not be as acute as 5 to 10 minutes because the infection will take time to spread in the body. Okay, so it can develop within 1 or 2 or 3 days. Okay, depending on the organism. Now, transfusion-related acute lung injury will again present as with features of an ARDS, that is the acute respiratory distress syndrome. There is a whiteout of your lungs on X-ray. It will usually develop within 24 to 48 hours, but okay, it can develop as soon as 12 hours also. And the patient will have marked decrease in his oxygen saturation, increase in his respiratory rate. Okay. So this is what you need to know. You need to see the time. Now, acutest reactions will be your hemolytic and your anaphylactic. Then comes your febrile, and then these things take around 12 to 24 hours at least. So what happens is, even though you are removing and you are segregating, you do the apheresis on the blood, you separate out the red blood cells, and you give your packed RBCs, there is some elements of your WBCs, some cytokines of the donor body that persist in that blood. And when those enter your body from someone else's, these cytokines and these WBCs generate a febrile reaction. It is very much benign, but it needs to be treated. So you have to stop giving blood to the person. You have to stop uh, the blood transfusion. You have to wait, then you have to match, and you can give another blood again. Okay. Also, or sometimes if the febrile condition is very much under control or the patient is bleeding a lot, so you really don't have an option of stopping the blood, you can give it in a very slow drip. Okay, you can decrease the drip of the blood also. Now, coming to the anaphylactic transfusion reaction, it is of course some IgE mast cell involvement. So the IgE, it's possible that some of the components in the donor blood have already been exposed to you, and your body has developed some IgE IgE response, and there is already docked on mast cells ready to fight. And once the donor foreign particles enter your body, the IgE will generate an anaphylactic reaction. Acute hemolytic transfusion is because of your ABO incompatibility. It is a crime. It is a crime. You can be sent to jail if this happens. So make sure you always read the label of the blood bag that you are given. This will happen in your internship as well. So just read what blood group we are talking about. It matches the blood group of the donor or not. Okay. Now, acute lung injury is again because of the lung parenchyma damage because of certain cytokines that they believe Another condition is a transfusion related volume overload, which happens when you give a very fast drip of blood. So a lot of blood enters your body at the same time, and your body is not able to manage that fluid overload. So it causes pulmonary edema. So it will have similar features. You will have breathing difficulty, but it will be pulmonary edema and not an acute lung injury, and somewhat cardiogenic in origin. Okay, so you need to differentiate between those two.
Thanks for watching. Please give a thumbs up and subscribe for more.